Hello again everyone. As I promised in the previous video, I'm going to basically be showing the encyclopedia of everything to do with weight loss surgery here. I hope the guys at Streamline Surgical don't mind I'm doing this. I think this is incredibly important to know the information in this. You can get it without it being a documentation form like this from when you go through multiple stages, like you see your psychiatrist, a dietitian, you see your consultant, surgeon. You have a pre-assessment phone call. You have your actual pre-assessment, and all of this stuff is laid out for you. At least when it's done privately here in the UK. But there's questions in here that I didn't even know I wanted answering until I read it. So this document I'm about to show you, that I'm going to skim through very quickly, is some 28 pages long. So I'm going to be skimming through and telling you to pause. You can pause whenever you want. But the contents, so you're aware, are welcome, which I think is irrelevant to people unless they go privately through this hospital, so I'll probably not really talk about that. An introduction to gastric sleeve surgery, the surgical pathway, risks and complications, life after your operation, the preoperative diet, learning how to eat. Oh, I've got wind. Learning how to eat with a gastric sleeve, frequently asked questions, and psychological preparation for weight loss. So without any further ado, much like I did in my last video, I've got to make myself way smaller. So, but firstly, I need to get rid of. See, the dog's now found this guy on a lawnmower, and he's very interested. He's like, food, look at him. Woo! Right. So let's do this. Boom. I'm way too big. Let's go a little smaller. Ready? And I'm shrunk. There you go. Much like I'll be in 6 months when I've had my surgery. So here we go. You ready? I'm going to skim through this at a fairly brisk pace. Pause when you're ready. Here we go. 3, 2, 1. Welcome. An intro to the gastric sleeve. The surgical pathway. The operation. Recovery. Follow-up. Discharge information. Stockings. Risks and complications. Long-term complications. Life after your operation. The pre-op diet. We've already done a video on that. Learning how to eat with a gastric sleeve. Oh, this is long. Calcium intake. FAQ. Loads of questions over there. Frequently asked questions. Psychological preparation for weight loss. Very important if you're an emotional eater, which I'm not. I was just incredibly lazy. And I ate terribly. And boom, we're done. So what I'm going to do, if I went over all these pages in a document, in a video, sorry, this could go on for hours. So I'm going to let you read it and make your own judgment based on what's written here. What is worth pointing out, much like I did in the last video, it's a case of all this information is relevant to me and my surgery through this specific hospital. Some things might be different, procedures might be different. I'm not a medical professional in any way, shape or form. But I found myself asking a billion questions to the point where the hospital just ended up sending me this to get rid of me. They were going to send it to me eventually, but they sent it to me very early on, which was fantastic to read. So what I will do, because I think this is interesting, is I'm just going to skim through some of the frequently asked questions and the answers. Without going into too much detail, it's just interesting to know. Can I eat baby food? No. There you go. What if I get constipated? Make sure you're drinking 2 to 3 litres of fluid per day and increase your fibre intake by adding a teaspoon of dark brown linseeds into your breakfast, cereals or meals. Alternatively, there's a soluble dietary fibre that can be added to drinks, blah, blah, blah. Can I buy convenience food? By convenience food, I guess that means like ready meals, pre-prepared stuff. Processed foods are best avoided, but if you really do not have time to prepare all your meals, convenience food can be eaten, but try to choose the healthiest options. There may be sugar in low-fat foods. Oh! As a single guy living in Birmingham whose culinary skills and cooking skills are not fantastic, that was a relief to hear. I'm getting help with getting my meals prepared, but there's going to be a time when I can't get them prepared, at least through the puree stage. So knowing that is good, and there are some incredibly low fat, probably less than a couple of grams ready meals out there from like Weight Watchers and the specialist ready meals. So that's good to know, but that isn't just after operation. That is probably months down the line. It will be months down the line. Can I use meal replacements? No. These foods will not help you learn eating behavior. So this is in context of just after your operation, I imagine, in the subsequent months after that. No, is what it's saying here. You need to learn the eating behavior needed to achieve lifelong weight loss control. Fluid will pass through your gastric sleeve more quickly than food, with no sense of fullness and a return of your hunger soon after drinking. Okay. Can I take chewable multivitamins? In the first few weeks after surgery, if you cannot swallow tablets easily, chewable multivitamins are a reasonable alternative. That's good to know. I need to add them into my Amazon order because I bought over-the-counter normal vitamins, which are just tablets. And I don't know about you, but I do need to take a little bit of water down to get tablets in. These are not small. They are on the large side when it comes to a tablet. Let's see if I can even... Oh, I've lost one. One's gone. It's fallen off the... no, I got it right. They're about that size. The size of a fingernail. Oh, shit, I've lost it again. The size of a fingernail. I'm not going to be able to do that. Will I need blood tests after surgery? Annual blood tests are recommended. This is the interesting one. I've been told I've now got to have lifelong injections. Like I've got to do my own injections after surgery into my stomach for a certain period of time. I can't remember how long. I don't want to guess. I wanted to say like 2 weeks, but it might be a month. I don't know. Something like that. But after that, you have an appointment with your GP every 3 months to have B12 injections, and that's lifelong. So I've gone from someone that hadn't been to the doctors for like 20 years, not even when I had COVID, and I was feeling a little ill at that point, to having to go every 3 months. That's what happens when you get older, I guess. I'm 37 now. Will my hair fall out? I think we all know this, yes. Parts of it will. I like my hair on the short side anyway, so I'm sure it'll still be annoying. But should I take protein powders? We do not advise the addition of protein powders to your food. If you're able to eat the recommended diet each day with 50% of the meal being of good quality protein, supplementation should not be needed. Yes. So this is going to be months after the operation. Eat enough carbs, enough protein, I should say, sorry, and no need to have a shake. Sounds good to me. Are fruit smoothies allowed? Ideally not. Can I drink alcohol? Yes, you can drink alcohol after a sleeve. It may be absorbed more quickly than pre-surgery. Basically, and I've already told my friends that if we have a meetup post my operation, I'm going to need to have a non-carbonated drink, so no beer. That really does limit the list, doesn't it? There's certain cocktails, I guess. God knows what it will be, but I'll probably have half a tiny glass and I will be more drunk than you are after 4 beers, is what I've told them. Should I drink? I mean, I'm getting prepared for my sister's wedding, which is in like 12, 11 months' time. I can see myself having a glass that day to celebrate. Can I drink caffeine? Yep. What is dumping syndrome? Everyone talks about that in their videos. I don't need to go over that. How long does the operation take? For most surgeons, an easy sleeve in a BMI of 40 lady would take between 45 and 60 minutes, not including the anaesthetic time. A much more difficult 60 kg or 60 BMI man may take much longer, up to 2 hours. It isn't important how long a patient spends under anaesthetic. It is much more important that the operation is completed carefully, minimising the risk of complications. I'm just above 40, so hopefully mine's quick, easy, painless, and I've already spoke to my surgeon about this, and if you've got direct access to a surgeon, I don't know if you can via the NHS, plead with him politely to suck the air out. Plead with him politely. I flagged this on a phone call to my surgeon, and he said, he explained why they do it, which I didn't really know at the time, but it made sense. They pump gas in so they're able to see better when they're doing it. He says that he makes a point of hoovering it out. I think that was his saying. And he's also said that he'll get it out, like not to worry. I'm sure there'll be some left. They can't get everything out. But he did say that he would have the anaesthetist basically. Is it anaesthetist? It might be. I don't know who does this. I'm not a medical person. They're gonna numb the diaphragm, or yeah, that's what he said. They're basically gonna numb that area internally. So fingers crossed that happens. If he does that, he's gonna get a big tip. How long will I be in hospital for? I can answer that question. I've already been told. I have paid for 2 nights. It's by default 2 nights. They said, 50% of people go out the next day, after the night after surgery. The fact I've paid for 2 nights. I mean, if there's no complications, I'm ready and raring to go. Let's just go home. I will. But if there's any niggling down my back of my mind, I'm just going to do the 2 days. Unless there's any more complications, I have to stay longer. How much should I take off work? This is the really big question. Half the reason why I've put on this weight is because I started a business that's been quite successful and growing rapidly, and we've had loads of new business over the last 18 months. I haven't left the confines of this chair. I would sit at my desk, and I'd only stand up to go to the toilet or to grab food, and I'd come back and it would just be awful food, warmed up food from yesterday or ready meals. And I would just work for 13 hours a day. And that was a life choice I made. It's why I am who I am now in terms of my weight. So for me, sitting in this chair, I've been legitimately told 4 or 5 days post-op. So theoretically, I'm being done on Thursday. I could have a go on Monday, see if I can sit in this chair. I've been told a week max, so that's good. But if you are physical, as it says here, you should plan to take 2 weeks off work if your work involves heavy lifting, such as a care assistant. Recovery after surgery varies from person to person, with a few patients needing more than 2 weeks off. There you go. When can I drive? I don't drive, so I didn't read this section, but you should refrain from driving for at least 10 days until you're sure you can do an emergency stop. There you go. And you should inform your insurance company that you've had an operation before driving again. There you go. When can I fly? Preferably not for the first 6 weeks after surgery. There you go. Do you suture? What? There's a word. I'm 37. I've never seen that word before. Do you suture the staple line? This is a technical question. Some surgeons believe that they can reduce the risk of a leak and bleeding by over-sewing the staple line. There is very little evidence to support this view, and some evidence that it may cause leaks, so we do not over-sew the staple line. Okay. Again, different hospitals might be different. Can I stretch the sleeve? With time, it'll get easier to eat, but the sleeve will never stretch enough to be anywhere near the stomach's original capacity. Working with the sleeve for the long term, making good food choices, chewing your food well, and avoiding high sugar or fat-containing foods and alcohol is different. It is very easy to fall into the trap of eating poorly, favouring semi-solid liquid foods that are easy to eat, and have a high calorie content, or drinking too much alcohol with all its hidden calories. In our view, weight regain is primarily due to making poor food choices, which allow you to eat more, which allow you to eat more, not the volume of the sleeve increasing significantly. So, basically, don't eat crap. Take care of yourself. Get your proteins and carbs in. and you'll be doing yourself a favour. Will I get loose skin? Yes. The appearance of loose skin will be determined by how much weight you lose and where from. If you lose a very large amount of weight, inevitably your skin will be looser. It tends not to be an issue for men, because they wear their fat on the inside, but it can be very concerning for the ladies. Ladies tend to complain of abdominal apron, loose skin around their upper arms and thighs. Yeah, I have thought about this. I've seen a few before and after pictures of other YouTubers. I'm not very body conscious now, considering what I've allowed myself to become. But if it's enough that it annoys me and it gets in the way of dating, and just feeling good about myself, I'll probably pay privately to have the abdominoplasty, whatever it's called. But yeah, it sucks that it's much more of an issue for ladies. Until I read this, I had no idea. I just assumed everyone had the same sort of weight loss, like loose skin. I am mentally prepared for that. I think that losing weight, adding about 10 years to my life, increasing my ability to sleep. I don't have sleep apnea, but I snore, and this is going to help just improve my sleep. You can see the bags under my eyes. I've had trouble sleeping most of my adult life because of being overweight. I imagine that's definitely a factor. So, like, just the health benefits are going to outweigh the fact I may have 2 vertical lines of flab that kind of stick out a little bit. If I get very conscious, I'll wear one of those corsets you can get, like the band that goes around the stomach. But, yeah. Will exercise get rid of loose skin? No. That's a short answer. What can I do about loose skin? Surgery. Will I feel hungry? Yes and no. For patients, there seems to be 2 types of hunger. An innate, psychological, hormone-driven hunger that makes us go looking for food to survive. This hormonal pathway will be interrupted by the sleeve gastrectomy. So you should feel less hungry. But there is an emotional head hunger, as covered in the psychological section of this booklet, that can return after surgery and be more difficult to manage. Yeah, that's just some interesting points they've made here. I'm not going to dwell on a few of these or go into this in much more detail. You can read this yourself. What I found... I'll tell you my story. I paid my deposit, which is like £1,000, and then I got sent this document. So they're like, we know he's 100% doing this. Like, he's, we're now not on the hook to pay the consultants, etc., because I paid the £1,000. I got sent this document. I got to this page, and like I was that close to paying the remainder of my fees, another like 1,500, and I just stopped on this page, and I went, I need to talk to someone. I was doing it around this time at night, so like 11 p.m, and I thought, nah, I need to. So I called up the support line the next day, and they said that, again, the benefits outweigh the risk. They didn't say it this way, but my impression of it is that they need to let you know what the risks are, so you've got a well-rounded view, and not just a well-rounded stomach. That makes sense. But I was still like, I've lost like 7 pounds in my first week. Maybe I just go on some insane diet and shed the weight myself. And then I thought, no, I've tried this previously. It doesn't work. I just can't. As soon as I'm doing well, I for some reason put on a few pounds, and I just lose the will to try. So, very kindly, these guys at Streamline set up a meeting with my surgeon. And he essentially put my mind at ease, saying that, look at his record on the National Bariatric Surgeons database. He gave me a link, I can't remember it. But he has like a 99.9% success rate. That 0.01% is like a revision he had to do after there were complications. He said it's incredibly rare. Within his group of surgeons in around London, they like he'd heard of one death this year in 2021, and that was a guy who was, his BMI was off the charts, 70ish. I can't remember. It was very high BMI. He was morbidly, chronically obese to the point where he was very hard to walk. So on that note, I don't want to put anyone off by this page. I got put off until I read it. I got put off when I read it. Deaf. Our surgeons have a mortality rate below 0.1%, or 1 in 1,000. I questioned that to the guy, and he said it's more like 1 in 10,000 in like the last year, based on what he told me in like their network of surgeons. For an individual patient, risk varies between 1 in 2,000 for a low risk, I guess that's me, otherwise healthy patient, to about 1 in 50 for an exceptionally high risk, very large patient who has heart disease or other illnesses related to their weight. Your individual risk of death will be discussed with you before surgery. Again, I'm fortunate in that regard. I have no health-related issues, no heart disease, no high. I mean, my cholesterol's high, but it's not to the point where it's nuclear catastrophic. It'll be fixed by the surgery. So I've got no underlying health conditions, apart from that broken neck I told you in my last video about the pain threshold. But I did that as a kid. So yeah, this is obviously scary to read. And then I called my mum, the last person I called was my mum, and I explained everything. And she said, son, like, I've had both shoulders done, like shoulder surgery, and the risks were fairly similar-ish. Maybe it's like 1 in 10,000 have like an adverse reaction to what we're doing. Scraping out, I believe it's scraping out the old shoulder, or replacing tendons. It's gross. And that takes way longer than weight loss surgery too. I'll tell you that, because I was at the hospital waiting for her to have it done. And she said it's not even worth thinking about. If you thought about that, if that's what stopped you having surgery, you're one of those people that may never leave the house because you might catch a common cold, or you might get hit by a car, or you might trip over and hurt yourself. You know, there's risks with absolutely everything. There's risks with like the cocodamol that I have to take occasionally for my whiplash. There's risks with everything. I could overdose on that by accident and be in serious trouble. So yeah, enough of me blabbering. You learned that from the last video. What I'll do as a little bonus, I'm going to add in supplements and blood tests. Again, I'm going to skim through this. It's not very long. It talks about the multivitamins you need, the vitamin D, iron, calcium, the blood tests that you'll need to have done, and some frequently asked questions. Now I've essentially shown you the documentation that I've had been given, and I just genuinely believe if by making this available, it's going to help a lot of people. That's why I've done it. Yeah, so there we go. I guess it's not that different from being given this as a handout and just physically holding up the handout in front of you, so I don't think I'll get in any trouble by doing this. I hope not. That's not my intention, Streamline. I find that I had a lot of questions answered here, and hopefully you do too. So the next video update is going to be a video update from my actual appointment. I'm not calling it a surgery, it's an appointment with a doctor to have 80% of my stomach taken out. So until then, hopefully that all goes well, and I will see you on the next video. Take care.